Hi, this is Kelly Hall, President and CEO of the Longview Chamber. Welcome to Coffee Conversation. In the fall of 2015, our Board of Directors adopted a 5-year strategic plan called REACH. There are 5 buckets we focus on: redevelopment, education, advocacy, collaboration, and health. Today, we are going to focus on how the Longview Chamber puts its feet to the ground and rolls up our sleeves in order to discuss this topic of health and well-being. That's why I've asked Jennifer Ware, the Director of Marketing and Communications with Christus Good Shepherd Health Systems, to join me in this discussion. Why? Because the Chamber serves as the catalyst to drive conversations around health and well-being. Jennifer, last month we went over a lot of information about the why the Chamber's engaged and serves as that catalyst.
Right.
This month, I want us to delve a little bit deeper. I'm going to ask some questions, and we're just going to have a conversation around data, next steps, who needs to be at the table, etc. But there's one thing I just want to remind everybody of, and it's a statement that was made by the Robert Wood Johnson Foundation recently. For the first time in the U.S. history, we are raising a generation of children who may live sicker and die younger than their parents' generation. That's alarming to me. And I think that's a good place for us to start. So let's talk a little bit about the national lens and what that data is telling us.
Sure. So I think no one would be surprised to know that healthcare spending in the U.S. has risen dramatically over the past several decades. And as we look at it now, annual spending in the U.S. on healthcare is around $3 trillion.
I'm sorry, did you say trillion?
That's trillion with a T.
Trillion? Okay, sorry.
So, and we find a lot of ways to spend that money, and a lot of it is spent on chronic conditions. 1 in 5 Americans are living with 1 or more chronic conditions. A significant amount of them are even living with 5 or more. So that's really, when we look at health and well-being, a lot of those chronic conditions are things that we can look at preventing or helping people improve, which would also drive down a lot of that healthcare spending.
So let's drill that down to the local level.
Sure.
Because $3 trillion, I mean, that's just such a huge number. Mm-hmm. I'm thinking it's somebody else's problem. But, right? That's the government's problem. Yeah. The reality is it's not. It's our problem because it's impacting our local businesses' bottom line. Mm-hmm. Can you talk a little bit about that?
Sure. So, I mean, the bottom line is healthy employees are good business. An unhealthy workforce directly impacts businesses and employers, and you can look at even just the annual loss of productivity due to health-related concerns with employees is around $226 billion a year. That also includes, and this is just sort of an interesting aside, more of us are coming to work sick. So it's not just about people missing work and then that loss of productivity there. It's also people coming to work and they really should be at home getting better, but are we creating that culture where people feel like, you know what, I really can take the day off and take care of myself? So that also kind of ties into it really being a multifaceted approach, and how can we build that culture not just in our community but in our workplace so that people feel like it's okay and even encouraged to take good care of themselves.
And then as an employer of a small business, because we only have 7.5 employees, I'm not sure if I'm the half because I'm so short, but the reality is it takes all of us being on all the time to move what we need to move through. Mm-hmm. And when 1 or 2 people are out sick, I mean, it really has a devastating impact on the quality of work that we can get done, the accuracy, or the focus, all of it. But yet, after reading the data and spending the last several months understanding more about what building a culture of health means, it means I, as a leader and influencer in this company, needs to set the example and show empathy and say, guys, if you're not well, it impacts all of us. And I think you're spot on. And as a employer, sometimes that's a total shift from my generation because we weren't trained this way.
Mm-hmm.
So,
well, and I think, a nice simple way to kind of wrap it all up is people, productivity, and well-being are all 100% interconnected. You can't separate out those different pieces. So it really takes looking at all of that together as an employer. And I think you're spot on with saying it's about leading by example and taking care of yourself so that it sets the tone for your other employees that, they should really do the same.
One of the things I just, as we're sitting here talking, thought of, so many times when we talk about health and well-being, we think being sick or being well. We think nutrition, diet. We think, oh gosh, I've got to go walk my 10,000 steps a day, have my Fitbit on. But it really is more than that. Mm. So let's talk a little bit about that holistic approach to what well-being is, and what are those lenses?
Sure. I think, previously, like you said, we really looked at health as just not being sick. But now we know that a lot of complex social factors really play into your overall health and well-being. So, I think something that was touched on, I think, by Texas Bank and Trust at the luncheon was spirituality and spiritual health is such a key component of that. Mm-hmm. It's also things like stress management. That's a lot of what feedback, if you look just at reading, in general out there about stress and well-being in the workplace, that's a chief complaint of a lot of employees. So are we managing our stress? And that doesn't mean you have to learn how to do yoga 5 days a week and bend like a pretzel, but I think your idea here at the Chamber is great. You have a quiet space that was formerly, I think, a closet, right? So right. Not a lot of investment. That's not building out a full wellness facility, but providing a quiet space so that people can, I need to take a minute, take a deep breath, recharge, and then get back at it. So it's looking at not just, like you said, steps, but are you taking care of yourself spiritually and mentally, also physically? But it's all of those things coming together.
And financially.
Absolutely.
The financial component is huge in well-being because it drives so many stress factors. I know that one of the local churches here in Longview actually offers Dave Ramsey financial planning classes. And it's a very, easy thing to do with employees is to bring them in and let them have some time. Another thing that was interesting to me is one of our local businesses brought in, yes, a nutritionist, but it wasn't about diet. It was about food as energy and how that energy helps us be more effective, more fun, and allows us to love ourselves and others better. Maybe for some that sounds a little ooh, but the reality is if we can't take care of ourselves, how will we ever take care of our peers and our family and our community? So I just thought that was pretty interesting. We touched on this a little bit last month, but I want to make sure that we're thinking this through. Sure. Why do you believe the Chamber needs to be involved in this conversation?
Well, I think, like we just talked about before, the Chamber really is in the perfect position to focus on this and sort of lead the charge. Not just in health, but in those other elements of reach that you mentioned. The Chamber really serves to bring everyone together from different industries, different areas of the community to work toward those shared interests and common goals. So, it's going to take all of us working together, but I think the Chamber, like I said, is really in a unique spot to sort of lead this charge and help bring people to the table.
Good. Well, I believe that, so I'm glad that you do too. What are the steps or what's the process that you would recommend to the business leaders, community influencers on how to lead this charge and how can we build a culture of health and thrive and sustain it?
Yeah. Well, I think, a recent example of people already engaged in that is the comprehensive plan. You look around the room at the Chamber events and at community events and people are engaged. I think as someone who didn't grow up in Longview, we've been here a while now, but it's really inspiring and makes me feel really great about choosing to live here when you see how much people care about being involved in our community. I feel like anytime you stand up and ask for a volunteer, you've got more than you can handle. So, I think it's about being engaged in making those decisions and driving those processes forward that impact our community overall. So, are we showing up to meetings and giving our input on, yes, we want bike lanes and walking trails? Are we putting our money as a community behind those things that support where we want to get to. So I think it's really about driving engagement, and then a lot of times when we talk about things, like advocacy or public affairs or health, it sounds really great in big picture, but when it comes down to how to operationalize that, I feel like a lot of times the immediate reaction is just sort of crickets, well, what do I actually do? So I think it's about those little things, and like you talked about before, just those steps and that layering, so that over time what we see is it wasn't one giant project or program, it was all of these little steps we took together to really move us in the direction we want to go.
So when Jennifer started, and I call her Jen because I know Jen, we started with the national lens, and then we started bringing it back home and some of the things that are already happening. But again, I love the way Jennifer phrased, it's like crickets in the room. And I think it's because we may not be armed with enough good information. So will you share with us the piece about the Gregg County data?
Sure.
And what does the health community look like today?
Sure. So every year they come out with the county health rankings, and that looks at a number of factors, so healthy behaviors, health outcomes, and then they rank the counties around the U.S. So for this year, Gregg County ranked 190th out of 242 counties for health outcomes, and 227th out of 242 for health behaviors like smoking, obesity, physical inactivity. So, I like a silver lining. So I think the positive spin on that is we have plenty of room for improvement. I think there's a lot of things we can do to move that needle and improve our ranking for next year. But I think the data is really clear that we've got some work to do.
So what do you see those next steps being for us?
Well, we had the luncheon. That was a great start. We had the CEO breakfast with, I think, around 50 employers in the room kind of talking about what do they need, what are they looking for. So I think our next step would be to let's get more people engaged and bring them together and start developing really a strategic plan for where do we want to go next. And I think a really simple thing, and one of the things we heard at the breakfast was, how do we pull all of our resources into one central online location? So I think that would be a great place to start, even if it's pulling together, let's just start with a calendar of what are these things that already exist, what's already happening in the community, and giving people that, I like to say, that single source of truth for where to find health and well-being information.
I think that's very doable. And together we can get that done.
Absolutely.
I do believe that. At the beginning of our conversation, I discussed how at our very core, the Chamber believes in representing the interest of business by strengthening our local economy, creating opportunities, and a better life for all. We also understand we must work together to create the vibrant business community we all dream about. And I believe it can be accomplished with a free enterprise economy. It's the Chamber's job to tell our story. It's our job to influence decision making. We have a choice, and we can shape our future by working together. Can you imagine the impact that we will have on our economy by bringing together partners from across the trade area to advocate for real solutions? By taking action, we will strengthen our economy, and our business community can continue to build and to strengthen our local talent pipeline. Jennifer, thanks for joining us today. It's always fun having you, and thank you for everything you bring to the table, your knowledge, your expertise, your passion. We appreciate you being a part of Coffee Conversations.
Absolutely.
Will you join the movement?